ఎలక్షన్ అప్డేట్స్ను అందరికంటే ముందుగానే తెలుసుకోవాలంటే ఈరోజే RTV లైవ్ యాప్ని మీ మొబైల్లో డౌన్లోడ్ చేసుకోండి.
హాయ్ హలో వెల్కమ్ టు RTV హెల్త్. నేను మీ దీప్తి. జనరల్గా పిల్లలకు కొంచెం వేడెక్కంగానే తల్లిదండ్రులు ఆందోళన పడుతూ ఉంటారు. వచ్చింది టైఫాయిడో మలేరియానో అని భయపడుతూ ఉంటారు. అసలు పిల్లల్లో జ్వరం వచ్చినప్పుడు ఎప్పుడు ప్రమాదకరం, అలాంటప్పుడు ఎలాంటి జాగ్రత్తలు తీసుకోవాలో ఈరోజు మనం డాక్టర్ గారిని అడిగి తెలుసుకుందాం. సో ఈ విషయాలన్నీ మనకి తెలియజేయడం కోసం ఈరోజు మన ముందున్నారు డాక్టర్ ఆవష్ కుమార్, కన్సల్టెంట్ పీడియాట్రిషియన్, అపోలో క్రెడిల్ అండ్ చిల్డ్రన్స్ హాస్పిటల్. హలో సార్, హౌ ఆర్ యూ టుడే?
I'm doing good. How are you?
జనరల్గా మనం పిల్లల్లో ఈ జ్వరం అనేది ఎక్కువగా చూస్తూ ఉంటాం కదా. అసలు ఈ పిల్లల్లో జ్వరం రావడానికి గల కారణాలు ఏంటంటారు, వాటి లక్షణాలు ఎలా ఉంటాయి?
So, fever is the most common cause for OPD visits by children. Parents bring their children most commonly for fever. Other things, cough, cold and other things are also there. But
Okay.
by far fever is the most common symptom when parents get worried and start bringing the child to hospital. So fever comes because of mostly body trying to fight infection. There are other causes also.
Okay.
But most common cause is body, if some virus or bacteria is entering our body has to fight it.
Okay.
By the use of chemicals and other immunity things in our body. So for those things to work, the body temperature has to rise. Then only the chemical reactions will work better.
Okay.
And body can fight the fever, fight the infections better.
Okay.
That is why fever comes mostly.
సో అసలు ఈ పిల్లల్లో జ్వరం రావడానికి ఎలాంటి లక్షణాలు వస్తాయి అంటారు?
Yes, so mostly it is the infections. Presently, if you can see, viral infections are very high. Others are bacterial infections, and then dengue, malaria, COVID was one instance which we saw very closely. So mainly it is infectious. Then there are some non-infectious causes of fever also, like it might be due to cancers also and rheumatoid disease also. Some serious. So the common viral ones are the non-serious, and cancers and other leukemia and all, they can also cause fever. Various reasons are there.
Okay.
So mostly, thankfully, it is the common causes which we are seeing in the children mostly, depending on the season.
ఓకే. సో జనరల్గా ఈ పిల్లల్లో ఫీవర్ ఎక్కువగా రావడానికి కారణాలు ఏమేమి ఉంటాయి అంటారు?
Yes, so fever, temperature rise will be there. So normal temperature is 98, 99 like that. If it is more than 100 to 102, we can call mild fever.
Okay.
102 to 105, moderate fever. More than 105, very severe fever.
Okay.
But parents usually come to us by 101 and 102 types fever.
Okay.
Because they can't wait longer.
Okay.
So that is how the range of fever. Then the age group. If the age group is less than like 6 months or 1 year, then we should be little careful and judging along with fever what else is there. If along with fever child is dull, irritable, not feeding, and vomiting is there or something, then it might be serious. So we should bring to hospital faster. If it's a bigger child having cough and cold, but he is active and running and eating nicely, when fever comes, he is little dull. When fever comes down, he is normal. Okay. Then we need not worry. You can wait 2-3 days also before approaching a doctor in such a case.
సో జనరల్గా ఈ పిల్లలకి ఫీవర్ వచ్చినప్పుడు ఎలాంటి సిమ్టమ్స్ కాజెస్ ఉన్నప్పుడు పేరెంట్స్ ఎక్కువగా వరి అవ్వాలి అంటారు?
Yeah, so now the traditional way is a thermometer, mercury thermometer, but nowadays we are not using it. Now digital thermometer is there, which can be used under the armpit or under the tongue for 2 minutes. It will give a beeping sound when the fever measurement is over. But because recently we had a COVID, now there are infrared thermometers widely available. Their accuracy is bit less, but they are very easy to use. Suppose child is crying, you don't have patience for 2 minutes waiting. So you can just use it off the forehead and you can have some idea that okay, fever is there or high fever is there. We need not measure exact temperature. We need to know if fever is there or not and it is high fever or not.
Okay.
These two are easily given us by the infrared forehead thermometer also, especially in case of children. So we can easily use those also.
ఓకే. సో జనరల్గా ఈ పిల్లలకి ఫీవర్ వచ్చినప్పుడు ఎలాంటి సిమ్టమ్స్ కాజెస్ ఉన్నప్పుడు పేరెంట్స్ ఎక్కువగా వరి అవ్వాలి అంటారు?
Yes. So as I told the child, if child is vomiting, not eating, and lot of loose motion suppose is there, especially dull and weak, not getting up from bed, and fever is going beyond 3-4 days, 5 days, fever is not coming down, and there is parents also need to be little bit aware. Suppose dengue season is going on, or COVID season is going on, then also they should think that okay, others are getting, so we might have also got dengue. So they should approach the hospital. But first and foremost is child is dull and not eating.
Okay.
That is the main.
Okay. So జనరల్గా పిల్లలకి ఫీవర్ వచ్చినప్పుడు పేరెంట్స్ ఇంట్లో అసలు ఏం చేయాలంటారు ఇమీడియట్గా?
So from their previous visits to hospitals, they might have a prescription for a paracetamol. So paracetamol is the most common medicine used for fever. It is very effective in managing fever, and it can be used safely by the parents if the recent prescriptions are available. Also, various charts are available on the box itself. Also, it will be written this much age, how much ml to be given. So they can safely use those guidelines and use for 1 or 2 days. If the child is otherwise okay, paracetamol can be given every 6 to 8 hourly. If fever is more than 100, 101, they should use. Okay. Some parents are using paracetamol at 99, 96, 97.5 like that. Those should not be used because we need fever also. Body needs fever is our friend. Initially for fighting some infection, little bit fever 100, 101 fever is acceptable and should not be treated. If fever goes high, then only sometimes it might cause fits in small children. Okay. So in those cases, fever medicine should be used, especially paracetamol. Other medicines like mefenamic acid is there and other higher medicines. Okay. That parent should avoid unless really they have used it in the in the past they have used and doctor guidance is there. Okay. Apart from medicine, other thing is adequate hydration. Okay. If you don't, some parents don't feed the child if there is an illness, thinking it will aggravate. Okay. But that is not correct. Food, soft diet should be given to child. Anything, rice, whatever, there is no restriction as such. Of course, masala and oil and all easily difficult to digest food should not be given. Easy to digest food and lot of water, ORS, water, buttermilk, all those things should be given. So if hydration is not there, fever increases more. Okay. So because body needs that water to operate, function properly. Okay. So medicine, then fever, hydration, then adequate diet, nutrition. Fourth thing is sponging. For high fever, you might have seen people putting water things on the forehead and armpits. So that is not a very effective. Cold water, small clothes and putting on the forehead and armpit. These are not effective. Okay. What is effective is taking a big piece of cloth, like this big piece of cloth, dipping it in lukewarm water, not cold water. Okay. And that whole body of the child has to be just made wet. Okay. So you can say painting rather than sponging. We use the word sponging. Sponging means you repeatedly rub and rub. That child gets irritated and it is not effective also. Okay. So what you do, you take lukewarm water, dip the cloth in water, just paint the child with water. If it is a small child like 4 or 5 year old child, it will just take 3 seconds to finish the process. Okay. Another 10 minutes is required to evaporate. Okay. So once the evaporation is done, then the fever will come down. So these are the 4 things that parents can do at home before they bring to hospital.
Okay. పిల్లలకు ఫీవర్ వచ్చినప్పుడు మనం ఇంట్లో జనరల్గా పేరెంట్స్ ఏం చేస్తారంటే వాళ్ళకి తెలిసిన మెడిసిన్ వాడుతూ ఉంటారు, లైక్ సిరప్స్, మెడిసిన్స్ అట్లా తీసుకుంటూ ఉంటారు. ఇలా కాకుండా అసలు వాళ్ళు ఏమేమి చేయకూడదు అంటారు పిల్లలకి?
మెడిసిన్ ఆన్ దేర్ ఓన్, ఎస్పెషల్లీ ఇన్ దిస్ లాస్ట్ I'll not say how many years, but the abuse of antibiotics has increased. So parents have to remember that fever mostly is due to virus, the fever that we are seeing around us, which comes in along with cough and cold. Child is active, other children in the flat or house also getting cough and cold. So this is mostly viral fever, the common jalbu that we call common cold. Okay. So for that antibiotic is not required. Okay. People equate antibiotic with that antibiotic can kill every organism. That is not correct. Antibiotic means antibacterial. Okay. It will kill only bacteria. So if the cause of the fever is bacteria, then antibiotic is helpful. If it is not, it's just general fever like with cough and cold, antibiotic is not useful. Okay. And it should be avoided. It is causing more harm than any help. It won't help at all. Okay. And other than that, putting child in cold water and avoiding to eat. Okay. And giving any other like unproven therapies which may harm the child also. These things parents should not do.
Okay. సో జనరల్గా ఫైనల్గా చూసుకున్నట్లయితే ఫీవర్ పిల్లలకి వచ్చినప్పుడు జనరల్గా డాక్టర్ని ఎప్పుడు కలవాలి, ఎలాంటి ఇన్వెస్టిగేషన్స్ చేయాలంటారు?
Yes. So investigation depends if the doctor is examined and he is thinking there is some malaria or dengue or some doubt, some differential diagnosis is coming to the doctor's mind. Okay. He wants to prove, then investigation is required. Like suppose 3-4 days only fever is there, child is clear cut having cough and cold, parents are having cough and cold, then there is no point in doing an investigation. It won't help. If doctor is suspecting some other underlying cause and there is a suppose dengue epidemic going on, okay, so the doctor will know that what is the current season of which disease is going on. Otherwise, if any other non-infectious is suspected and fever is going for more than 6-7 days not subsiding, then we can go for to search infectious cause or any other non-infectious cause we can think of. So 3-4 days easily they can wait if no serious symptoms are there.
ఓకే సార్, థ్యాంక్ యూ సార్, థ్యాంక్ యూ సో మచ్.
మరిన్ని వీడియోస్ కోసం ఛానల్ ని సబ్స్క్రైబ్ చేయండి, లేటెస్ట్ అప్డేట్స్ కోసం వాట్సాప్ ఛానల్ ని ఫాలో చేయండి అండ్ లింక్ డిస్క్రిప్షన్ లో ఉంది.